G'day guys, here's another edition of Fix It Yourself. This edition is about your lower back. So it's a really important part of the body, pivotal in fact. That's where we pivot from. So if there's a problem in your pivoting, in that movement right in the lower back, then you can have problems all over your body. So if you come over here for a minute, I just want to show you a bit of anatomy. So we look at this is the lower back region right in here. But this is with the superficial muscles on. If we take them away a bit, we can see that there's layers here. So we're looking at particularly the white section. So see how that all spreads up and goes into the lats, up into the arm here. And then these deep ones go up into the ribs and off the ribs and stuff like that. So if we go to this one here, we can see this white bit on here. That is the lat there. Then we've got some deeper ones that go off into the rib. So that comes from the lower spine, the lumbar spine. And I want to show you this one here. So you can see this white bit here connecting onto the sacrum. I'll show you the sacrum in a minute. So that goes up the back, and see how all this kind of drifts off and goes into the ribs. Then we've got other ones that start right in the lower back here in the money spot bit, and they come up into the ribs as well, but off into the other side of the spine. So they're all about lateral movement. So being able to move sideways and bend. So very important. So if we look at the skeleton here, you can just see how intricate it is. So we've got the pelvis here. This is your sacrum. So you look at the sacrum, look at the nerves coming out of the sacrum and the depth here. So we've got, this has all got tissue, like real thick rubber tissue in here. It's the real thick fascia. So that is deep, it's really thick, so it's embedded in there. So that tissue, if that becomes hard and compressed, that will affect the ability to squish and stretch and move. So it all comes through here. See how deep this is. So this is really thick muscle and fascia through here. So you saw I'll show you in this one here. So we've got little muscles that attach from the transverse process, sideways process, into the spinous process, so sideways, but also up. So that gives you ability to flex. When that shortens, that'll bring that bone here down that way. So that is what we want to get into. So all these things in here, this is where our money spot is. So you might have seen the money spot in other videos, right into here. So this, if there's stuff that's stuck in here, that's the start of where that pivot needs to happen, that bending, that movement. So we need to get right into these spots. So wherever you can see deep spots and little bits on the bones, I can just see that sort of the little shadows there. That's where really strong muscles need to attach onto. So it's really important that this in here is moving and functioning well. So when this gets more solid than it should be, then that doesn't allow the movement to bend, and that's where that sort of starts. So that's going to affect up the body, but it also can affect around the body as well. So these sort of spots, they can shoot pain down our leg, into our glute, into our groin even, and up our back. So this spot in here, clearing out this spot here, around here a bit and up into the spine, is critical for the body's function. So we want to be able to get right in and affect these little multifidus muscles, these ones that we were working on and we were looking at here. So these ones in here, we want to get into that depth. So that's the deepest you can get. So we want to get and melt this really thick fascia at the start, affect it, really pin it and melt it, hold onto it, and then start to be able to move properly again. So I just want to show you on my own body. So what we want to do, we've got right in that spot in there, that's where the lumbar spine comes down here and my sacrum comes up around here. So we want to get right into that bit there and then work down onto the sacrum itself and around here towards the pelvis and then up into the spine. So a place to start working on yourself is actually working into the body. So what we would have done first as well is you twist and move and sort of find out exactly where your spots are. So we want to kind of move and stand up and things like that and figure out where you're jamming. So then you can kind of have that measure to how you're moving, what it feels like, where the pain points are, and then once you've done this work, you can test it again. So you always want to move your body around, explore movement, and then kind of gain awareness of where that pain is, where that lack of movement is, where that lack of function is, and then see what happens once you measure it. So what I'm doing here, I'm pushing right in sideways into that spinous process there, in between it. I can feel that gap there, and then I'm tuning in to what feels right. Okay, so we want to feel for good pain. We don't want trauma. Okay, we want to feel it and we want to hold it. Okay, so with your thumbs, you can do really effective work. You can fix things. They're a great tool. They're a really good shape. So it's like a piece for the jigsaw puzzle. I'm just going to shift down like that. And what I can do from this position here, I can move around a little. Okay, so I can kind of shift around so I can change the part of my spine that I'm actually can connect with. Those aspects where those little bits of solidness can be stuck. They can be hidden behind something, and we want to weave in and get right into that skeleton level so that we can make a real permanent change. Just going to shift down. So I want to actually go down to that money spot now. So that's right in there. So I grab my skeleton again. So it's right, so on my left hand side, so it's right into here. So what I was trying to do, I was trying to push into these spots in here, really into there and into there, and I'm going into here now to try and work out all these different little spots. And I'm going to drift out here a little. So what I want to do is go right into that spot there. So you'll just sort of know it. If you've got pain in here, you'll know it. But even anybody that doesn't have pain, this is a really pivotal spot, like we were saying before, that everyone will know it when you hook onto the right spot. It'll just feel like it's really good. It's like a relief. And if you have got a problem in here, dysfunction here, you'll be instant pain, even with just a little bit of pressure. So you just got to go in gradually, soften it a little, so I can go backwards, and then that'll soften. Then I can actually pin it. Then I can do these little movements just to get right into it. So pushing out, I want to trace around there like that and try and find exactly the spots, and you'll know it because of the pain. The sensations will tell you exactly how it's moving, how dysfunctional it is. We can work onto the sacrum. So just thumb pressure in here, holding the spots. Remember how we looked at the sacrum before? There's like a mountain range through the middle of it. So in these little spots near the mountain range, that's where there's potential for that stuff to get stuck, stagnant. It doesn't move as much. So when that becomes more and more solid, it freezes, then you got to, that's where problems start. So they start at the origin, right where that attaches onto the bone. So we're going at that kind of level there. Okay, so I'm not even worrying about away from the bone at this stage. So another way to start working on yourself is just with your fist. So you can kind of find spots, or your knuckles. You probably won't see that this well, but you'll get the idea. So you kind of here, put your knuckle into the spot where you want. You find the place with your knuckle, or like that. And then you can use your own body weight to kind of put weight and pressure down through it. Then you can kind of move, like use your feet a bit. So you get up onto your feet like this, and then you can judge or manage the amount of pressure you want. So you start with your butt on the ground, and then you lift it up. You can kind of take one foot up with even more weight going through you, like that. And so I can really feel with that knuckle, I can feel exactly on my spine, just exactly where I want to have pressure, and just tune in, be intuitive, trust yourself. You know your own body. You are the expert on your body. You can fix yourself. You know exactly what it needs. The sensations are telling you exactly what you want. They tell you it's good. Push through it. Hold it, hold it, hold it. Wait for it to melt. Once it's melted, then you explore spots. You just move around, and then you then you go on to the next bit, because the body will tell you where to go next. So the really important thing we want you to do first, before you go to looking for massage tools, we want you to get a real good understanding with your hands. So that's the really important bit, because with the feedback of your hands, you can feel temperature, You just sort of sense so much more the feeling. You can sense when it's hard pushing back into your thumbs and into your knuckles, things like that, or into your pisiform as it might be. So you're getting a really good understanding and a good measure. So you've got to remember the pains, remember where they are. Remember, because if you do it again, say in a week's time, you have another go at this, you're going to have that comparison too. How sore was it the first time? So then you can kind of go, okay, now that's better now. And then you can move around and things like that. And because you've taken pressure or tension off one spot, then that tension might go to another place, or awareness of something else that is really sore and jammed up might appear. But you weren't aware of that because there's so overwhelming sort of pain and pressure and dysfunction in another place. So I want to go through some massage tools. So we've been around the house, we've found the pestle, and so this is like a rounder, a bigger surface. So it's sort of something we can start with and start to work into the body. So we can kind of go like this. So I can kind of try and soften that area and make sure it's really solid on the ground. We don't want to slip, and just try and really work into the spot that we want. So I'm really close to the spine. I'm not jamming right onto it, but really close to it, and trying to get those little multifidus rotator muscles and work through those superficial muscles and get in really deep, right into where it's all started. Melt through that really thick rubber fascia stuff. Work into it. So I'm just on that one spot, haven't shifted, but I've changed angles just by moving my body around that little bit. So just doing these little shimmies, if you can pick that up like that, just to change angles and just discover exactly where it's stuck in my body. Okay, so you do that like with a bigger tool. So I've got a few things like a wooden spoon, a roller, but I like this one because you can kind of use that roller bit to kind of, it'll move with you. You can kind of move up and down and just really kind of locate exactly where that spot is. And with this one as well, you can kind of move this handle a little. So with this, what I might do with this one is just go onto the sacrum. So you can kind of see me, I'm going down onto the sacrum, that bit that had the mountain range on it, all the nerves were coming out of it. And we want to pin on that so I can manage the weight, the pressure that's going through it by just dropping my weight into it. I'm on my elbow here, so I can kind of take some of the weight on my elbow, but then I can just drop my pelvis and just let it kind of go like that. So now there's lots of pressure going through it. Feels good, huh?
Yeah, you loving it?
Yeah! Getting myself good. So when you're getting yourself good, you just gotta breathe and let it go. And you just know those spots. Some of them have been there for years, you know. You've been there for 20 decades. Depending how old you are.
20 decades.
Yeah. You're as old as me, maybe 20 decades. Anyway, you just keep on exploring and going into these sort of spots. So, same with the wooden spoon. It's kind of like a
rolling pin.
A rolling pin. Oh, sorry, guys. I don't get in the kitchen much, huh? Raw fooder. We don't roll things out. So yeah, like that. This is a good one too, because then you can kind of, I can push down and that pushes up into things. And this one I'm going up around that lip on the, so it's like our second money spot. I can roll onto it and then push up into it and really get myself good. Okay, so that's pretty similar to this one. But then if you want really detailed work, wooden spoon. So sometimes this might be a good shape, you know, to go into spots. But the handle, you might have a round handle. This is a flat one, so I can get in right in close to the spine. So what I'm going to do first up is try and soften it like that. Yeah. And so you just know, whoa, yeah. So I'm just softening it, and then I'm gradually getting more weight on. Make sure that this end is not going to slip out. So good to do this on carpet or a rug. Oh yeah. So I'm just putting all my weight now pretty much onto a spot. Whoa. So be careful with this one. You gotta be careful. But Ninja's favourite. Oh, I better show you the ball. Just because this is pretty standard. Most people we'll have a ball. This is a little cross ball. So what we want to do, we want to just find the spot. So you're going to roll down into it like that. So I'm just saying, yeah, I found a spot there. So then I'll lie down and then put my feet up on the wall like that, and just wait there. Just wait for that to sink in, melt like that. And then once I've kind of waited there for a bit, so this is probably getting towards that point, then I can kind of go lift my butt up and then just sink my weight down into it like that. And then I just wait. So I'm tuning into those sensations. They're just talking to me. They tell me, yeah, that's good, that's old pain, that's stuck in there. Okay, and then once it kind of melts, then I just sort of shimmy, explore an angle, just move my hips, those little micro movements, and explore up, down, out around that, you know, along the top of that sacrum towards the crest, like that. And then you can go down onto the sacrum and work into that mountain range where those nerves are potentially stuck and blocked, like that. So you just keep on working, you just hold them, you just be patient, don't rush this. Wait for those tissues to melt and respond, and then once they kind of respond and that kind of initial sensation goes, then you kind of shimmy, move on, and then the body will tell you where to go. Okay, so now I want to show you the big gun.
The big gun.
When you really want to get into it, you get out your, it's just a wooden spoon, is it? So it's the old broomstick. So what we want to do, we shorten that for a start, lean back and go like that. So just wait. And then I can just sort of shimmy into those spots and just find those really good angles. So I can kind of go up and down like that. Just wait, I can angle in. Okay, so I'm right in close to my spine. The side of the broomstick is touching my spine, and then I'm spearing right in. So I want to push through all those layers, and I'm going to get to my skeleton. Skeleton, where all those tendons are joining on, those really thick white bits that are in the diagrams, that's the really thick rubbery bits. We want to change that tissue. It's stuck, it's dense, it's blocked, it's scarred up. So we want to get into that tissue and wait for it to change. It's got to disperse, it's got to transform. Okay, we've got to challenge it just so that we can change those tissues. Okay, so I want to show you just one more thing, is we want to change an angle. Okay, so I've got my key on my window there. Let's get those out of the road. So I've got to get into the spot for a start. So that takes a little bit of time, so don't rush this bit here. Get into that bit there. And so we want to get into that money spot. So that's like spearing on that 45-degree angle. So we want to spear into there and then push up. So I'm pushing with this leg up into it. So I want to be, oh yeah, right close. So I can kind of just do these little micro movements just to try and angle it and get into those spots like that. So I can just stay on that spot. And so this is the key to the body in some instances. So for a lot of people we've had in the clinic over the years, this is the spot we've concentrated on, and no one's ever been able to get to it. And they've known it's been there. This is the origin of everything in their body. So if you can get into the depth that you need, and you just know that this is the spot, okay? A lot of times this is the spot that just needs to be worked just so everything can start to pivot and move again. Okay, right into there, so we can change an angle. We can shift it out, yeah, like that. So just all these little micro moves, they are sending intelligent information to me about how this is performing in here, how stuck it is, how blocked up, and just where I need to go. So I can change like this. Change my angles, and I can hit a different aspect of that part of my body that needs to be kind of worked through, the flow regained, so that the body can heal itself and function better again. Like that. So you just explore this. So you can do this sort of onto your sacrum as well. You can probably get a
Good indentation.
see where I've been in. So I've got into it really deep. And,
Thorough.
yeah. See all the blood rushing in there. It's going to create a change. So yeah, lower back. It's very important for the body. You might know that when your lower back's not functioning well, how do you feel? No confidence, disempowered. You know, this is such an important part of our body to be functioning well, to be strong, to be able to stand up properly, up straight, you know. So it can be really reflective in how you are mentally as well. So we really encourage you to fix your lower back up because it's going to transfer into many other aspects of your life. You know, so it starts with the cleaning, the plumbing we call it. So start to work into it, push into it. You're not going to understand it unless you start to tackle it, start to approach it, start to get information about what's going on in here. And it might be a little bit traumatic or uncomfortable, things like this to start with, but go at your own pace and push it a little bit. Push it, don't be scared, you'll be right. Trust yourself. Don't be, you know, to an authority. Kind of trust in yourself, trust in your own ability to understand your own body. You are the expert. You know yourself better than anybody else. Don't let anybody kind of judge you and say that you're fucked. You're not. You can fix things, but you just got to go with a systematic approach, understanding what the tissues are saying to you, how they respond. So that's the important thing. We got to move our body, understand it, lift things, move, walk, climb, see what it's saying, how is it responding, how functional is it, how strong is it, and then you get to know. So then you do some work, cleaning work, how does it feel, let the integration of the body and mind happen. So then you start to go on a pathway. It'll show you where to go, because once you take the tension, the pressure of one place, something else will might become apparent, you know, just where something else might have been tight and lacking strength or something like that, and you weren't aware of it because it was overwhelming pain just in this spot in your lower back. So you just go on a journey. So yeah, you got it. In order to change things, you have to push into it. It's not going to change without you challenging it. It's just it's a push and pull type situation. Push into it, pull back and see what happens. Give it time to heal, 2, 3, even 7 days after a really good going over. So anyway, that'll do for now. Watch more of our Fix It Yourself series. I'm sure you'll get a lot out of it. And yeah, have a go. Done. Oh, it's great day to be alive.
Oi! Hey, fellas!
Party tricks. Hello, boys. Ugh.
I got you in 3 mirrors here, or 2 mirrors and you.
Getting fancy with you.
Getting fancy
Spielberg
with me. Yeah.
Oh. 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 There you go. Oh. Anyway, we had a little bit of a look back through the tape and wasn't completely happy with how we explained things, so I just want to clarify a few things. So just with the skeleton here, we want to show exactly where we want to get into. So if we've got the ball, we want to get right into these spots, okay? So we want to go around the top of here. We want to go right up along this set of section here. We want to get right in. See how deep these spots are. So you can actually get the ball and kind of hit in to these deep fascial lines. There's fascia that's really thick rubber. It goes in here, embeds in here, but it also comes right out here. So we want to get in and get it into this bone level and compress it right down. So if you look at the way the ball can hit into these kind of spots, that's what we want to do, we want to achieve. So wooden spoon might be a better, this is like, the rolling pin. How do I muck that up every time? So we want to get into these spots. We want to hit into these sort of crevices, these nooks and crannies, okay? We want to hit in right into this bone level and just really squish these tissues that are compressed and get in there and work them, okay, like that, on these bits here, and free up these nerves and things like that. So if that makes it a little bit clearer, when we got the wooden spoon in, this is actually a wooden spoon. When we got in here, we were trying to get right in here, and these little multifidus and rotators, we're trying to work right in. Remember, some go, you know, from across here, and some go up onto the next kind of one. We want to hit on these muscles and really work them out. So you can really tune in and work it right in, because there's going to be muscles that are joining on here and they go up. So we want to hit right onto them. So hopefully that clears it up a bit. Same with the old broomstick. So we want to get on these angles, we want to work it so we can get in there, different angles, work it out. Get right in the side like that. And we can hit right in on the fascia that's covering the sacrum here, and get right in onto these little mountain range type things and work out and free up where those nerves are coming out. Okay, and so I want to give you a few more ideas about the old the broomstick as well. So just so you can see a bit better angles. So we want to really make sure it's secure. So really make sure you practice this and be safe. When you're getting it into the right spot, go slow for a start. Don't try and push in too hard early. Cool. And soften it. So I've got to lean backwards like that, soften it, and then what I can do, I can change angles like that. Change angles, forwards, backwards, just trying to really explore so I can hit right into good spots. Okay, so then when you're on a good spot, you wait there, wait for it to just dissipate, and then explore again, move, different angles, things like that. Okay. Move around. So yeah, make sure you just explore and be safe, and then you shift it to another spot. But we want to show you another angle as well. So you can actually, what might actually be better is getting on the floor and then trying to get that into the money spot. So what we can do, see I'm arching back like that. Arching back, and then try and hit, yeah, like that, hit into a spot. So arching back, that softens the back because it's shortening it, so then it's softer, then we can hit right in. Then we want to get in right in next to the spine where I was talking about. So you can do like that, so just so I can show you. So then you can kind of really push back into it like that. You move your little bits of your body around that little bits like that, just so you can hit on the spots. So I can go back there, I can feel that I'm going right into it. Ah, yeah, like that. And hitting right where you need it. So yeah, be intuitive, hit the spots you need them, wait on them, have patience, clear them out. So yeah, so hopefully that was a bit clearer demonstration about what we want you to do and where you want you to get into. And yeah, you can definitely make massive changes to your body. Wait for it all to dissolve and transform, and yeah, going to be $1 million after you do this. So yeah, get into it, have a go, but use your intuition, don't go beyond your boundaries, and yeah, let us know how you go.
Rolling, boys.
Rolling pin.
Nah, it's a wooden spoon, mate.
There's me wooden spoon.
Oh, golly.
G'day guys, here's another fucking... Got a crook back or what?